What happens when a rural hospital closes, and your mother suffers a stroke 47 miles away from immediate help? In that moment, Congresswoman Jasmine Crockett represented what millions of Americans felt but were too afraid to voice. People are dying while you fund fences. Within just 5 impactful minutes, she dismantled Marjorie Taylor Greene's relentless attack on public health funding. The fallout from her confrontation rippled across the nation. As Greene fell silent, Crockett's words ignited a widespread movement demanding compassion and accountability in healthcare. But what exactly did she say that reverberated throughout the room? Stay with us as we explore a pivotal story that is worth every moment of your attention. The hearing room was cold and sterile, illuminated by harsh fluorescent lights that drained the color from the wood-paneled walls. Rows of leather chairs filled the U-shaped desk as lawmakers in dark suits took their seats, each with tense expressions. Flags stood stiffly behind the podium, and red timers blinked down relentlessly. Aides whispered, papers shuffled, smiles were conspicuously absent. The air felt thick, heavy with a tension that hinted at the storm brewing beneath the surface. On the live feed, the announcement read, Budget Oversight Hearing on Federal Health Funding. While many viewers saw it merely as a political spectacle, the atmosphere inside the room crackled with an intensity that spoke of lives at stake. Jasmine Crockett sat poised, her pen racing across her notebook as she prepared to engage. A former Dallas prosecutor turned congresswoman, Jasmine was calm, unreadable, and observant, not indulging in theatrics but carefully assessing her surroundings. She had opted for a sharp navy suit, foregoing makeup, presenting herself authentically as she focused on the task ahead. Then came Marjorie Taylor Greene, the click of her heels echoing loudly against the floor as she strode toward the room with a thick folder beneath her arm and a striking red blazer that demanded attention. Her entrance was bold and contrived for impact. She thrived in the drama and spectacle that marked her political persona. With a swift motion, Greene flipped open her binder like a weapon, unveiling a collection of accusations and screenshots aimed directly at public health initiatives. Locking eyes with Crockett, she smirked, confident in her victory. She was not prepared for what lay ahead. Without waiting for formal introduction or acknowledgement from the chair, Greene leaned forward and pressed the button on her microphone with a sharp snap, a sound that ricocheted in the charged air. Let's just be honest here, she began, her voice steady yet laced with steel. This hearing isn't truly about helping people. It's about where we're allocating funds, and right now they're going to all the wrong places. With deliberate motions, she flipped open her binder, presenting a photo that depicted a mobile health van parked outside a grocery store, a small line of patients waiting outside with lawn chairs. We're spending millions on this, she declared with disdain. Free clinics crossing the country, distributing medicine to those who don't even contribute to the system. Is this what we call healthcare now? She slammed the photo onto the desk and leaned back slightly, shoulders squared, maintaining a facade of confidence. I'm sorry, but this isn't sustainable. It's not even sensible. We're pouring billions into programs that fail to provide solutions. They only perpetuate dependence, she asserted, her boldness cutting through the tension. While she articulated her viewpoint, Greene began scanning the room, gauging the reactions of her colleagues. Meanwhile, our border is wide open, drug cartels are trafficking fentanyl and human beings with ease. Instead of focusing on that, we're funding another mobile clinic in Oregon. That's backward, she argued, her voice rising with fervor. Here's my proposal. Let's divert $3 billion away from these health programs and reallocate it to securing the southern border with the people and technology that can actually stop these threats, she stated emphatically, projecting an image of righteous indignation. I would much prefer to see that money go toward boots on the ground and maintaining barriers, rather than wasting it on free flu shots at a church in Wisconsin. Low murmurs emerged behind her, but Greene didn't flinch. She leaned into it, embracing the tension. And before anyone says, I don't care, let's clear this up. This isn't about lack of compassion. It's about prudently managing our resources. Every dollar needs to be allocated to safeguarding American families, and right now, that calls for securing our borders, she reinforced, oblivious to the growing discontent. Greene locked eyes with Jasmine for a moment, allowing tension to hang in the air as she continued to amplify her rhetoric. "I know some of my colleagues across the aisle will attempt to tug at your heartstrings today," she said, her tone slightly mocking. "They may talk about fairness or feelings, about someone who cried because they couldn't afford a prescription." She leaned back in her chair, exuding calm, hard certainty as she concluded, "But I won't apologize for my desires to maintain order. If it's a choice between funding a mobile unit or stopping the next drug shipment across our borders, I choose to secure the border." Setting her folder down, she performed a subtle power play, folding her hands and leaning back confidently while the momentum seemed to tip in her favor. The air crackled with expectation, but just as Greene mixed her next move, she reached into her folder and pulled out a small remote, pointing it toward a screen behind her. A video flickered to life. It was raw, unedited footage, shaky and grainy. The visual depicted another mobile health van parked outside a food bank, volunteers efficiently distributing care packages to people in need. None of the video was softened, it was stark and revealing. "This is what we're funding," Greene stated, slow and deliberate. Vans driving around as if they're ice cream vendors, giving out medication like Halloween candy. No insurance required, no ID necessary, no questions asked. You just show up and receive your gift bag. She paused, allowing the gravity of her visuals to settle. "You call that care?" Greene demanded, casting a look of derision around the room. "Because to me, it resembles nothing more than a government-sponsored giveaway." The chill in her tone invited tension, drawing attention away from compassion. "They aren't emergency rooms, they're handout stations, and no one is asking about the actual costs involved in this." She held up a new sheet of paper, the detail evident in her delivery. "Let me give you the facts. Case number 1. A 38-year-old male, unemployed for the past 5 years, walks in, gets free insulin with no questions, claiming he's just between jobs. Case number 2. A 24-year-old female, healthy, receiving anxiety medication and birth control simply because she's stressed about student loans. This is what we consider medical necessity, now?" The atmosphere charged even more, Greene's contempt leaching into every word. "Now let me be clear. This discussion isn't about trauma. This isn't about heart attacks and parking lots. This is about comfort and convenience. We're nurturing a culture that encourages people not to take responsibility. Instead, we allow them to simply receive." She gestured towards the screen, indicating a man receiving a bag filled with essentials. "That bag he's holding doesn't symbolize care, it symbolizes dependency. It essentially signals, you don't have to take responsibility. Someone else will do it for you. That's surrender disguised as kindness." Greene's voice radiated conviction, but Jasmine remained attentive. No interruptions, no hasty commentary. She occupied a quiet space, digesting Greene's continuous assault on healthcare, hurting as she listened, processing not just Greene's accusations, but the reality behind them too. After Greene delivered her barrage of claims, she turned to address the public. "This is your money," she declared to the viewers at home, leaning into the camera. "Every prescription, every gas gallon for these vans, every clipboard, it all comes from your hard-earned paycheck. And these programs? They want more, billions more." With an unwavering tone, Greene concluded, "You call it community health. I call it political charity. The type that keeps people grounded and calls it assistance. And I, for one, have had enough." As her voice echoed throughout the room, Jasmine felt the tension shift. It was her moment to respond. She had absorbed Greene's words, constructing her counter-argument in real time. Jasmine knew what she needed to say, but she also understood the weight of her narrative. When she finally leaned into her microphone, she maintained a level tone, but her message cut through the atmosphere like a blade. Congresswoman Greene, she began, shifting the spotlight effortlessly. Have you ever sat in the back of an ambulance, racing against time for someone you love whose life is slipping away? Jasmine's words hung in the air, each syllable resonating beyond the confines of political narratives. Have you actually experienced that dread? The kind where it's just you, the driver, and the fear that help is nowhere to be found? She paused to let the gravity of her story settle in. For Jasmine, it wasn't just a question, it was a recollection, one laden with memory. She recalled being 9 years old and witnessing her mother collapse on their porch. A scene etched into her mind, vivid and haunting. There was no hospital in our town when my mother fell. They had shut it down the year prior due to budget cuts and staffing shortages, she recalled, her voice steady and evocative. We waited for help that never came. All we had was my uncle, haphazardly racing down bumpy back roads in a pickup truck, trying to reach an emergency room far beyond our neighborhood. The room felt lighter, almost electric, as every word Jasmine spoke carried the weight of personal experience. Fortunately, we made it in time, but I remembered a nurse whispering to another, 10 more minutes, and she wouldn't have made it. That message became ingrained in me. The lawmakers watching couldn't break their eyes away as Jasmine continued recounting the narrative. Now, when I hear discussions about reallocating billions of dollars away from healthcare, I don't perceive strategy. I see warning signs. I envision mothers collapsing on porches with no hope, struggling to breathe while surrounded by inaction. With each statistic she provided, Jasmine painted a clearer picture of a healthcare system in crisis. In Newton County, Missouri, the hospital shut down last October. The nearest ER is now 47 miles away, and there's only one clinic left, a single nurse working 2 afternoons a week. Looking around the room, she made it clear that Greene's arguments were misdirected. And you want to tell me that money would be better spent on building more fences? Let me clarify. What does a wall do for someone experiencing a stroke in the woods? The reality of Crockett's words weighed heavily upon Greene, and the tension in the room reached its peak. You keep insisting this isn't personal, that this is just numbers. But for people like me, where I come from, these aren't statistics. These are lives written in heartache, in tragedy, in unanswered calls for help. She paused, allowing the gravity of her words to settle as she searched for connection. She turned her gaze back toward Greene yet again. You continue to assert this is about being smart with our funding. But when we choose to prioritize barriers over people's lives, what does that say about our values? Crockett articulated her concerns with a resilience that rippled through the room. Let's talk about the reality. When small hospitals close down due to budget cuts, it leads to increased mortality rates, often by as much as 30% in these overlooked communities. When we ignore healthcare access, we usher in a grave injustice. The atmosphere crackled with anticipation as Jasmine positioned her closing arguments. FEMA has identified the lack of local healthcare as a national risk, recognized alongside the threats of power grid failures and cyber attacks. We cannot underestimate the consequences of failing to provide adequate emergency services. With each word, she underscored her points through sheer conviction. When disasters strike small towns lacking accessible medical care, lives are lost, not because they did anything wrong but simply because help was too far away, uninformed, and under-resourced. In the same confident tone she'd maintained throughout, Jasmine faced Greene. You call it budgeting, I call it neglect. A country cannot genuinely claim strength when its citizens are left gasping in parking lots due to a lack of care, she said firmly. When she finally finished her statement, the room was suffused with a heavy silence. No one moved or spoke as the truth resided over them all like a cloak. Yet Jasmine wasn't finished. If we have $12 billion to keep people out, we can surely allocate $300 million to save lives, to ensure that our healthcare systems don't become the next tragic statistic. This isn't merely a matter of politics, this is about human lives. And if we continue to disregard the needs of our citizens for the sake of funding projects for political gain, we're fostering abandonment and neglect. We're actively choosing to leave people behind, she concluded, pulling up her notes one last time. From that moment on, the room transformed. Greene, once confident and dynamic, faltered. Her poise twisted into uncertainty. The fiery, aggressive stance she had maintained now felt empty, stripped bare by the fervor in Jasmine's voice. "Jasmine, you've gone too far," Greene spluttered, visibly shaken. "I didn't come here to hear sob stories. This is serious." But the shifted atmosphere was undeniable. Greene's bravado had evaporated, leaving only the lingering weight of truth. As Jasmine sat there, unwavering, she realized that this was more than just a debate. It was about the lives shadowed behind statistics. It was about reminding everyone that every single individual deserves health care, regardless of location or socioeconomic status. As the hearing concluded, an unanticipated acknowledgement reverberated through the chamber. Greene's sharp demeanor had dulled, and with that shift in power, Jasmine felt the winds of change begin to blow. Far from the confines and theater of Washington, a new movement lingered on the horizon. The quiet release of words transformed the narrative surrounding healthcare justice. And as news of her powerful testimony began to circulate, gatherings in homes and communities began vibing with a resonating heartbeat of hope and solidarity, creating ripples of awareness nationwide. This story is not merely about the debate. It's a profound reminder of the human experience often overlooked. It serves as a revolution against neglect and an unwavering stand for the people. A plea to ensure that no one falls behind because politics chose to ignore them. This marks the beginning of something larger, a movement demanding equitable health care where every voice matters, every story is recognized, and every life is valued. Jasmine Crockett didn't just speak truth to power, she ignited a movement that transcended the walls of Congress, compelling millions to rise up for their own lives and the lives of their loved ones. In those pivotal moments, every single individual understood that they too could champion change, standing united for justice in healthcare, resonating across America.